Good day everyone, I'm Krisha Maria Pelga, and for today I'm going to perform bed bathing. Now, what is bed bath? Bed bath is a bath performed in the bed, given some client who isn't able to bath himself or herself. So the number one purpose is to prevent the bacteria spreading on skin. The number two, to clean the client's body. 3. To stimulate the circulation. 4. To improve general muscular tone and joint. 5. To help client comfort and help to induce sleep. And lastly, to observe skin conditions and objective symptoms. So in performing bed bath, we are guided by the following guidelines. So number 1 is to confirm the doctor's order, because sometimes the bath order may have changed. Also, to check the client's identification and condition. This is because for some instances, giving bed bath may be harmful for a client who is in pain, hemorrhaging, or weak. The next thing that we have to do is to greet our clients and establish rapport. We need to ask them about personal hygiene preferences and their ability to assist with the procedure. For today, I will be performing bed bath. For the initial procedure, first I have to greet the client and also validate some information. So in validating information, we have to observe the band of our client to state his or her name and also birthday. Good day, Mom. This is Krisha, your caregiver for today. May I have your name and your birthday, Mom? Birthday? Okay, Mom. How are you, Mom?
I'm fine.
So today, I will be performing bed bathing. So I will be cleaning your body while you are in bed. Is this okay to you, Mom?
Okay lang.
After establishing report, we have to prepare all the equipments needed for bed bath. So I have all the equipments here. We need to remember that prior to performing bed bath, we need to perform proper hand hygiene, of course. Then we have also our gloves, but this is optional. But this is a must when performing perineal and anal care. Close the windows and door to provide a warmth and privacy to our patient. But we have to check the temperature of the patient. Your temperature is 36.5, Ma'am, and it is normal. Then over the bedpan, if possible, encourage the patient to urinate first before the procedure. Adjust the bed to appropriate working height at the waist level. Lock the wheels of the bed for the safety of the patient. Side drills down. Next, we have to change the top sheet with the bath blanket. And remove the client clothes. So after we have covered the patient with our blanket, we can now proceed in removing pillow. Next step is to get the basin, which is full of water. Let the client check the temperature of the water if it is comfortable to them. Is it okay? And also put a big towel under her head. And a towel over her chest. Let's now proceed in making the bed bath. We can now proceed in cleaning the client's eyes. Wash the client's eyes, cleanse from inner to outer corner. Use the different section of the mitt to wash each eye. Wash. This is to avoid sweeping debris in the eyes of our clients and also to avoid the spread of infection.
Soap. Rinse. Dry.
Now, let's proceed to cleaning the face of our patient. So, in cleaning the face of our patient, we can use the soap only if they preferred it.
Wash, soap, rinse and dry the patient face using S shape. Then dry.
So, from the forehead, going to the nose, and from the nose, going to the chin. You may also want to include the ears of our patient as well as their neck.
Do the same on the other side. Soap.
So, from the forehead, going to the nose, and from the nose, going to the chin, you may also want to include the ears of our patient as well as their neck.
Rinse.
So, from the forehead, going to the nose, and from the nose, going to the chin. You may also want to include the ears of our patient as well as their neck.
Dry.
So after cleaning the face of our patient, we may now proceed to the upper limb. So in cleaning the upper limb, we can now the soap. We also need to do a long stroke, as long stroke stimulates circulation by facilitating venous return.
Wash.
We also want to start from the distal to the proximal, so from your hand up to the axilla.
Soap. Do the same on the other hand. Dry.
Now that we are done cleaning the limb, we now proceed to cleaning the chest and abdomen of the client. So one thing to remember is first to put the bath towel under the trunk of the client so that we may avoid wetting the bed, and also put the bath towel over his or her chest so that we may be able to provide privacy of our client's needs.
Wash. Soap. Rinse. Dry.
Now that we are done in cleaning the chest and the abdomen of the patient, and we already changed the water, we can now proceed to the lower limb. So in cleaning the lower limb, we have the bending knee of our client. This will allow us to have easier access to the top leg and also to the bottom part of the leg.
Wash, soap, rinse and dry the patient far leg. Then dry.
In cleaning the legs of our patient, we also want to start from distal to proximal. So from the foot of our patient to the knee, and from the knee to the upper part of our patient. After cleaning the lower leg of the patient, we may now proceed to cleaning the back and the buttock. The first thing that we have to do here is to turn them into lateral position. This will allow us to have easier access and visualization of your back. So if the client doesn't able to assist us in doing this procedure, the first thing that we have to do is to bend their knees and turn them into lateral position, making sure that you are gentle and when you move anything.
Wash, soap, rinse and dry the patient back and buttocks.
Sa ABS-CBN Entertainment YouTube and Facebook accounts. Sa
Offer back massage to relax and relieve muscle tension and to stimulate blood circulation with warm lotion. Position the patient in supine and put on new gown starting from affected site.
After performing all the steps in bed bathing, we have to make sure that the client is comfortable before we leave them. And after this, we can now document the procedure.